So let's look at GERD. And so this, one of the things that can be mistaken if someone have peptic ulcer, the kid will be mistaken to say that they have GERD. So the definition is a condition in which the gastric contents leak backwards from the stomach into the esophagus. So this is the lower esophageal splinter. This is the food in the stomach. So when we eat, the food starting to churn and turn, this is supposed to stay closed. But sometimes, because of smoking and other things, this area is open. So the acid, as I mentioned earlier on, that the stomach is very acidic. You have some of the chyme and the enzyme leaving from the stomach go up into the esophagus, so it starts cause burning. Now, what causes GERD? So when muscle fiber, which is the lower esophageal splinter, which I showed you just now, this, when it does not close well, gastric contents leak backwards into the esophagus. So reflux causes symptoms and can damage the esophagus. So risk factors include a hiatal hernia, someone with obesity, pregnancy, smoking, and scleroderma. So finding heartburn or burning pain in the chest. This increased by bending, stooping, laying down, eating. So they may have nausea after eating. For the pediatric population, they will have vomiting or spitting up with meal. They have failure to thrive, irritability, pallor, or even cyanosis. So what diagnostic tests will they do? They'll do a history and physical. They'll do a barium swallow. They'll do an esophageal gastroduodenoscopy, meaning that they'll put a camera down in the esophagus, down to the duodenum, and look, see what's going on. In addition to that, they'll check the pH, the esophageal pH. They will do an esophageal manometer study. This tests how well the esophagus works. In addition to that, they will do a scantigraphy. This assess the gastric emptying. So management. So this depends on the severity of the finding. So more frequent feeding with small burping, especially for the young child. Eat smaller meals and also decrease coffee intake. Avoid any food that is acidic. The patient should not lay down 2 hours after eating and sleeping with the head of the bed elevated, and the patient should be instructed to stop smoking. Now, they may give an H2 receptor antagonist, and this include Pepcid or Tagamet. They may give a proton pump inhibitor like Nexium or Protoxin or Prilosec. So over-the-counter anti-acid. They may even do surgery if needed. Surgery like our Nexium fundoplication. What they did is they took the top part of the stomach and wrap it around the esophagus. So nursing intervention, you want to monitor the person's nutrition because they have burning, they may not eat as often. Monitor electrolyte level, teaching points such as diet and medication.